Thank you to Minister Hayden. I know you're here on behalf of Minister Donnelly, I suppose as Minister for Health. Minister, the Government made a decision in January 2022 to acknowledge the incredible work by healthcare staff during the COVID pandemic and the service given in a crisis to keep people safe. You know, they went to work every day with patients who were sick from COVID-19. They faced more risk for themselves and especially vulnerable members of their own families when they came home. This pandemic special recognition payment of €1,000 is welcome for healthcare employees and their families, and so well deserved, especially in this time of rising costs. Contract employees in catering and cleaning services worked alongside HSE staff in hospitals across the country. They worked as a team, they provided essential services and infection control, bringing meals to patients in COVID-19 wards. However, now, close to a year and 6 months later, these contract employees have still not received payment. I raised this issue in the Shannon last November 2022 in relation to eligibility for payment. At that time, Minister Butler stated 124,000 eligible frontline HSE and Section 38 healthcare workers had been paid, and confirmed that contract employees eligible under certain criteria were eligible for this payment. Again, these contract employees, mainly women in Portiuncula Hospital, have come to me again to ask, where is their payment? And Minister, where is it? Why are they and their families left waiting? These staff on lower incomes are still waiting for this acknowledgement from government, the Department of Health and the HSE. They work alongside their colleagues employed directly by the HSE, doing the same roles, the same work, and they see how all other groups have been paid in advance of them. Now, HSE employees, nurses, doctors and health and social care professions received this payment last year, and well deserved. But why is this group left waiting? COSI manage the verification process on behalf of the HSE. They ensure eligibility and they ensure that everything is correct. That's great. And my colleague Fine Gael health spokesperson Colin Burke received a PQ response on this issue, noting that COSI, the group, are contracted to manage payments. But of these 4 cohorts, and they're divided into 4 cohorts, cohort 3, agency and contractor roles working in the HSE, have just 45% of payments completed. Now, I understand this could be between 80 to 100,000 people across contractors, but Minister, what is the Department of Health going to do to accelerate payments to cleaners and caterers? It is not good enough that these groups on low incomes are waiting a year and a half for recognition payment as a tribute to the risks they faced in difficult times. How is the Department of Health engaging with COSI on timelines and additional resources as required? And I mean, why aren't the contract agencies themselves prioritising correct employee information for COSI, especially as they're still under contract and receiving payments for work completed now in the HSE and the Department of Health? I'm aware that a number of submissions have been returned by COSI to contract agencies, and this is causing additional delays. How do we ensure that information has been provided even now to contract employees by their agencies and by COSI and the HSE on the timelines and reasons for delays? Employees have been left in the dark. Minister, there's to and fro with these agencies and COSI checking eligibility across thousands of employees and holding payments to all in an agency if any discrepancy. Minister, I'm asking here, are there measures for phased payments to groups of individuals approved within each agency? This could ensure that payments start issuing to approved batches of employees. It could speed this up. The group I spoke to in Portiuncula University Hospital, Minister, are proud of what they achieved and their engagement with patients and how they contributed to saving lives working with colleagues in hospitals across this country. Minister, it's important that this invaluable team spirit in hospital environments across the country is not tarnished by further delays.
Thank you, Senator Anish. Gleamish and Tara.
Can I start by thanking Senator Dolan for raising what is a really important issue, acknowledging your passion about this and your frustration, and giving the apologies on behalf of Minister for Health Stephen Donnelly that he couldn't be here today, and I'm taking this on his behalf, and acknowledge how you very clearly articulate the frustration that there is among your constituents, among the healthcare workers, not just in your area, but also all around the country that are impacted by this in cohort 3. Last year, as you know, Senator, the government announced tax-free COVID-19 recognition payment for frontline healthcare workers to recognise their unique and exceptional role during the pandemic. Following extensive union consultation, eligibility guidelines were first published online by the HSE on the 19th of April 2022. The government based its decision on the substantial risks which eligible healthcare workers faced. To be eligible, healthcare workers employed by the HSE Section 38 organisation must have been in COVID vaccination cohorts 1 or 2 and worked ordinarily in a COVID-19 exposed healthcare environment for at least a 4-week period between March and June 2020. In addition to HSE and Section 38 staff, 6 specific cohorts are eligible, subject to all other criteria. These include private sector independent nursing homes and hospices, eligible staff working on site in Section 39 long-term residential care facilities for people with disabilities, agency roles working in the HSE, healthcare support assistants, also known as home help, home care, home support, contracted to the HSE, members of the Defence Forces who redeployed to work in frontline COVID-19 exposed environments in the HSE, and paramedic staff employed by Dublin Fire Brigade to deliver services on behalf of the HSE. To date, over 205,000 eligible healthcare workers have received the pandemic recognition payment. As of the 5th of May, the HSE show 142,918 staff, 90,228 HSE staff, and an estimated 52,690 Section 38 staff. That's the breakdown of the 142,918 figure. The payment to staff in the HSE and Section 39 organisations is substantially complete, which are cohorts 1 and 2. Appeals for these specific groups were referred to an agreed joint HSE Management Union Committee. Over 3,500 appeals outcomes are now complete. Regarding non-public sector employees, the HSE and external contractor COSI Corporation continue significant efforts to progress payments to those eligible. This includes contract agency within cohort 3. Information on the process involved has now been provided to 849 organisations, and of these, 737 have applied for funding to make the recognition payment. 674 organisations have already been paid or approved for payments for 64,174 eligible staff. Due to complexities of staff in cohort 3, contractors had more supporting evidence to compile, while agencies have a large number of employees and employee locations to collate. These submissions are currently being managed through the COSI process. I'm told roughly 90% of submissions received to date included errors which required correction before payment. And the potential for overpayments here, I'm told, and the potential cost for the state will be €3.77 million. So further, over 400 organisations have submitted more than one claim. As this is a self-assessment process, it's difficult to assess accurately how many eligible staff remain to be paid. COSI continue to receive claim packs regularly. It's important to acknowledge that there will be individuals or groups of workers who also work tirelessly throughout the pandemic in very difficult circumstances who are not covered by these measures. The government considered this matter carefully, listening to the views of stakeholders before reaching its decision on eligibility. It was difficult to draw a line on the matter, but the government based its decision on the risks which eligible frontline healthcare workers faced.
Thank you. Senator Dolan.
Minister, we asked these workers to step up at the start of COVID. We asked them to do their jobs in spite of the risk of sickness before they had all the personal protective equipment. We asked them to go into work morning after morning with rising numbers every evening that we all heard. These people who are working in hospitals didn't ask the government to wait. They didn't ask them to wait until we had all the information on the symptoms. They did not ask the government to wait until there was a vaccine. They did this for the patients, and they put the patients first. Now, Minister, I appreciate your response here, but we need to accelerate payments to these groups. Something has to be done, and it's not clear in the response that's been provided here from the Department of Health. We need to ensure equity and fairness, and there's ways to do that. There's ways of looking at perhaps payments to batch groups that are approved within this, as opposed to thousands of people still waiting. And no indication of a timeline here, Minister. There's no indication of a timeline. When are they going to get paid? There's only 45%, according to a PQ response to Deputy Colin Burke, that have been paid out of cohort 3 to date. Gurmaga, thank you, and thank you, Minister, for your response.
Minister.
Carla, how are you? Look, again, I'm going to bring the points you raised, Senator, back to Minister Donnelly and his officials, because the points you raise are very valid. And as I say, I take this commencing matter on his behalf. The pandemic recognition payment is now in its final stages, with over 205,000 eligible employees now paid. The payment of eligible workers in the HSE and Section 38 organisations is substantially complete, as I've outlined, with over 3,500 appeals now complete. The HSE and COSI Corporation continue to process payment applications for eligible non-public sector employees as they are received. COSI established a separate portal for employees who do not have an employer to claim payment on their behalf. Claim packs are still received daily. So the pandemic recognition payment form part of a larger set of measures set out by government to acknowledge the hard work and challenges faced by Irish society during the COVID-19 pandemic. These measures also included a once-off public holiday which took place on the 18th of March 2022 that you're aware of, followed by the institution of the annual public holiday on St Bridget's Day going forward. So look, once again I would like to reiterate my appreciation and sincere gratitude for you to raise this point. I'll bring the points back that have been raised and articulate clearly your frustrations on this matter.